Alright, I'm going to show two quick examples of taping for the knee. One is going to be on the front side using kinesio tape, which is a pretty popular one these days because you see a lot of athletes using it on TV. It's this kind of stretchy stuff here. When you see it on TV, a lot of times the folks will have a real bright blue or bright pink, or there's also black colored ones. I like the flesh colored one just because a lot of people don't like having real obvious tape on them. Don't like drawing attention to themselves too much. But we use this for folks who have anterior knee pain. Also people who have pain with just bending their knee, whatever. A lot of times runners will be a common example of people who have this problem. But anyway, you're going to anchor it. You can either start at the bottom or the top, but just anchor it down here basically, and you can see how it's stretchy. That's 100% of its stretch. You're going to give about 20 to 30% of stretch, and then just kind of loop it around the outside of the kneecap, and then anchor it down to the bottom of the knee, the tibial tuberosity. And you just rub it a few times. The friction will create heat, which makes the tape stick a little bit better. And you want to do this with the knee in a bent position like this. Okay, and then we're going to do the same thing on the other side. Anchor at the top, 20 to 30% stretch. Bring it around the kneecap, anchored it at the bottom. Get some friction to tack the tape down. That way it doesn't get stuck on the clothes so easily. And when we straighten the knee, we've got wrinkles. That's what we're after. If you've got wrinkles when they straighten the knee when you're done, then you've done a good job. Okay, the second example, this is going to be taping for the back side of the knee. I'll most often use this when people have pain with end range extension. Getting their knee all the way back will hurt. They'll tend to walk with a little bit of a bend in their knee. So this is the different type of tape. This is the Endura tape kit. First we're just going to do a base layer of the white tape. I'm going to cross diagonally right across the back joint line of the knee, the posterior joint line. Just get the tape down nice and smooth to begin with. And then we're going to use the brown tape over the top of that. This is the tape that actually does the work here. Don't want it to be quite as long as the white piece because we want to keep this piece off of their skin. And we're going to pull from one point to the other, trying to get some skin wrinkles in there. Just like so. And then we're going to do a second tape in the exact same manner, just going in the opposite diagonal. So we're making an X across the back of the knee. One thing to be careful of is there can be a tendency to get all of the wrinkles kind of condensed in one spot. You want to try to spread them out over the whole course of the tape. You can see here I got most of them up at the top, so I'm going to do a second strip starting at the bottom so we can get some wrinkles down at the bottom of the edge here. But I'm going to gather up some skin like this, and this will give some good input to the back of the knee. Whenever she goes to straighten her knee, the tape will pull on the skin and will give her a bit of input through the skin against that direction. That's all there is to it.